A second case of MERS virus has been found in the U.S. MERS is short for Middle East Respiratory Syndrome. Most of the 538 cases have been in Saudi Arabia, but there were a few in Europe, Africa, and Asia. There have been 145 deaths so far. The Centers for Disease Control made today's announcement, and here's Dr. Jon LaPook.
The unidentified patient was a healthcare provider in Saudi Arabia. On May 1st, the patient took 4 flights from Jeddah, Saudi Arabia to London, then to Boston, Atlanta, and finally Orlando. While traveling, the patient developed fever, chills, and a slight cough. A week later, the patient went to the emergency room at a hospital in Orlando, was admitted, and is doing well. Both MERS cases in this country were contracted in Saudi Arabia. The first known imported case involved a man who traveled to Indiana last month. He spent a week and a half at Community Hospital in Munster, Indiana, and was released 3 days ago. With no specific treatment available, doctors in Florida are consulting with their counterparts in Indiana to discuss ways of dealing with the infection. Dr. Tom Frieden is the director of the CDC.
We think really there are 2 things going on. The first is that there does appear to be an increased number of cases. There are clusters in Saudi Arabia that we've not seen before. But the second thing is that we're recognizing it more.
The CDC says you are not considered to be at risk for MERS unless you've had close contact with an infected patient. And in the case of the Indiana patient who's doing well, even close contacts have all tested negative for the virus.
Thanks, John.